embrace worthiness and conquer inadequacy. Just to talk about that when we burn out, when we're stressed, when we don't feel very unmotivated to do something that before we were, and before something brought us joy and not anymore. I feel it right now. Also, I have this thing that a month before my birthday, I go into sort of like a shell. I don't know if anybody felt this way, where I have very little energy and it feels like I'm kind of transcending to something different, to another year of my life. And it's very easy to feel very inadequate in this kind of stages of your life, whatever is your stage. It's maybe something transitional, maybe you feel burnout like I am, or you going through something quite difficult. It's really, really easy to neglect your needs and neglect your inner peace. And I learned in really hard way to learn self-compassion when I feel down, because I feel like I need to go 100 miles per hour forever. But let's be honest, we can't do that. And we need to be incredibly gentle with ourselves. And most of my clients, when they feel quite down, they tend to beat themselves up. That I can't get up early, I can't do yoga, I can't do breathing or meditation or whatever practices they are doing, and I feel so really bad. But the idea is more bad you feel about whatever you're going through, less motivated, more compassionate and gentle you need to be with yourself. So this is how I decided to open this room. I know that you like sharing your stories with me, so I have a little bit of input in what you're going through. So if anybody have anything, any stories or anything to tell, if somebody wants to share something, I really welcome you to unmute yourself and share. I also wanted to introduce, because I see some people that I didn't see before. My name is Dr. Irina Campbell, and I have 18 years of experience in mental health. It doesn't mean that I always was a psychotherapist. I started as a psychiatrist. I was a medical student. Always was fascinated by how brain works, and decided that neurology was not for me, because I absolutely dislike my professor. So it was like such a shame, because I loved neurology, but it was just no for me. So I decided to go psychiatry route, and I was practicing for 7 years, and I went myself through a lot of trauma, which I can disclose if in the future you would be interested in. And my trauma brought me to the very bottom of me as a profession, me as a woman, me as maybe a mother back then. And I decided I was in a very low, very depressed state. And this is where there is nowhere to fall. This is where you have some sort of kind of gut. I want to do something completely ridiculous with my life, because I am already far too deep into, I'm sorry my language, but into shit. And by my accent, you can hear that I'm not an English speaker. So I decided to completely pivot my life and remove myself from the traumatic situation. And I not only change my profession. I thought that, well, I'll just do another degree. And I sent my resume everywhere around the world. And I didn't care about language barrier. I just wanted to get out and explore and be out there. I don't know, there's some sort of like this fierceness and anger open. So I was accepted to Edinburgh University in the UK. And without any language, without any connections, friends, or anybody who can support me, I moved from my country and moved to the country with a language that I didn't really speak really fluently. And I started to do my PhD. Not only started to do my PhD in another country with different language, I started to do my PhD as a single mom as well. It was quite difficult. My son was 2 years old, and it was quite a struggle, but I was loving every single of it. I was so determined, so angry at the circumstances that there is nothing that would stop me. I was just incredibly angry. And that probably what propelled me. And that is why my room also called Embrace Worthiness, Conquer Inadequacy, because I felt completely crushed by circumstances that I went through at certain periods of my life. And it didn't finish there, because when you move country, when you don't know the language, when you don't have friends, you feel completely alienated and very isolated. And it was really difficult to conquer my inadequacy, because inadequacy was I'm not belonging anywhere, not belonging to this country, to this language, to the society. There, maybe I was, from clinical perspective, I started to do my neuroscience degree. I was completely out of my comfort zone, and I didn't speak the language that they spoke. I mean, like professional academic language, absolutely didn't have that. But this anger was, it's a very potent, very fiery emotion to propel you out of adverse events. And we talked a bit in my room about confidence and self-worth. And I feel like self-worth was completely stripped off me by a person that I lived with, by my husband. There was none. Even though I was a practicing psychiatrist, I reached the heights at my age that everybody should be proud, but I wasn't. So when self-worthiness completely strip off, only confidence in what you do can build it up again. And me doing all these steps, this is where I started to see a bit more reality of, no, absolutely, it's just bullshit. Of course I'm worthy. And this is how I survived. And it's very long process. It took me probably around 10 years to really feel worthy, by building on the accomplishments. Through that, I extrapolated back, and worthiness is something that innately given to you, and it's never broken. It's always there. It's how I see it, it's just covered with a lot of layers of circumstances that we're going through. But when you start to clean it out a bit, this is where you see a little bit of glimmer through all this dirt that you are uncovering. And more you work on yourself, more you work on building yourself up, more you're clearing all this dirt off this golden nugget underneath. This is where you discover your self-worth again. And this is the metaphor I'm going to give you. This is how I discover. And I feel like I've done a lot of practices, lots of spiritual practices. I through my own discovery of psychotherapeutic technique that I would connect to. And the thing that I connected the most, some of you know, it's hypnotherapy. I think that's the beautiful, absolutely amazing tool that helped. Only that helped me. No talking therapy, no body therapy, nothing worked. I did a lot of spiritual practices, nothing really worked. And Mika has a question to me.
No, I was just listening in and just making sure that I was following you. I didn't mean to press the hand button. Sorry.
All right. Okay. Yes. And hypnotherapy is a beautiful tool to dive into, like, really objectivity of what you were going through. And this is what it did to me. I saw my story unburdened with the emotion that I probably felt, and this is more part of the dirt on my self-worth, emotional attachment to the story that I didn't want to let go, because I felt like, well, if I don't have my story, oh my goodness, who I am without my story. And hypnotherapy really gave me the perspective and the objectivity of what I was going through, because there was no objective reality what how I lived after my divorce. And then another adversity stroke after my PhD, COVID hit. I lost all my funding, I lost all my placements, I lost my career as a researcher. But like, again, I definitely didn't want to go back to the feeling of this emptiness and almost like a doom. And I decided to just connect, because connection for me, when it was lost, was the most difficult thing to rekindle. I didn't know that people would want to connect with me, because I felt like I'm not interested in completely thwarted reality. I'm not interested in, I'm not smart enough, maybe funny. I have this burden, I'm a single mom. Nobody would be interested to invite me on any social gathering. So completely twisted reality that I lived in. So I didn't want to go back to that reality again. So when COVID hit and we all felt quite isolated, I decided to just connect through just talking to people who were in the similar situation. And I love that. I felt like I missed that bit, being a clinician and being with the patient, being with the client, being with the person. And this is how I discovered back my psychotherapy. I already had quite a bit through psychiatry education, quite a bit of psychotherapeutic training, and I retrained myself in this country, in the UK, and this is where I started my new venture of being a psychotherapist. So I am psychotherapist from 2019, like licensed in the UK, but really being with clients, with patients, that is my lifetime journey. So this is why I want this embrace worthiness and conquer inadequacy, because I have very personal attachment to that, because I had to do that many, many times over. So that is my little story, because I know I see some faces that are very, very new to my room. And if you have anything similar to share, who wants to be heard, or who wants to say something about what they're going through, about worthiness, about Steve. No.
That was me.
All right.
That was me. Well, I really commend you for the story and your perseverance, and I'm sure that as you say that, it's kind of, there's a lot of layers in there that were you know, the ups and the downs. There's probably a lot of down in there. What's the first thing when you kind of realize, hey, you know, I have to make a change? What's the first things you focus on when you're talking and thinking about how I don't feel worthy or I feel inadequate? You know, do you have any tools or do you have anything an area that you focus on to help move that forward?
Yeah. Right now, yes. Back then, I probably didn't. This very, very negative voice that, oh my God, you just absolute failure in everything. Your career is kind of stuck. If I was doing my job for 7 years and I didn't really see much growth anymore. I grew very rapidly, really fast. And it was kind of like the top of what I can reach by that age. So I had to kind of wait until I mature to kind of hit some sort of administrative role that I really despise. I didn't really want to. So really, I felt like I felt stagnant. So that is one of the voices. Another voice from divorce is always like, I'm a bad wife. There was a lot of things was told to me how terrible of a person or woman I was.
Okay, thank you.
Yeah.
Now, you mentioned that you had, obviously, I mean, everybody goes through some levels of trauma.
Yeah.
And I'm just kind of similarly going through probably about 4 or 5 months into processing through a divorce. And was married 21 years. So the effect of her infidelity was pretty traumatic to me. I'm seeing a therapist, and we're kind of going through things on a flow that seems to be pretty consistent. But, you know, for you, I mean, you're somebody who studied this type of behavior. Was there anything specific that how you dealt with your trauma after you got educated on it? Because the trauma actually happened probably long before you went to school, right? And you probably went back and said, geez, this all happened and I got to kind of go through it, right?
Yeah. So how I got out of that situation back then, when I didn't have much of their support and I didn't really see very clear how I can get out. What I knew back then, without right now my hindsight and more objectivity on what happened back then. Back then, I just wanted to remove myself completely. This is what I done, and I probably don't recommend it to everyone. What I've done, I completely remove myself and put myself in a completely new environment with new people, with new surroundings. So I moved from one country to another. I moved from one profession to another. I moved from one set of friends to completely different. I completely switched, and sometimes I use that in a minor way. For example, very kind of simple example, one of my clients, she can't sleep in her room. She can sleep anywhere, but she can't sleep in your room. And what I suggested is just completely redo the room, change their floor, change the ceiling, change their all the bedding, change their furniture, everything. And this is where she could sleep again, because something reminds you about, you know, you work in the same street, you moving around the same people, you are, you know, smelling the same smells. So everything reminds you of the situation. It's not a greatest advice on trauma to remove yourself some, but this is what I did back then, and this is how I completely renewed my relationship with myself, because there was nothing that would remind me of the person that hurt me so bad. That was my back then way of dealing with that.
So I guess
because
it's
I
kind of
didn't
like reclaiming
have any other therapeutic.
Is that like reclaiming space or something? I mean, that would what I would think. Like, okay,
it's like reclaiming
thank you.
myself again, like without anything that is unburdened. Like I didn't want to hear anything from my friends, how they see the situation, my parents, how they see the situation, my colleagues seeing me going through divorce. I didn't want anybody to be, you know, sympathetic or tell me how they understand me. I didn't want anything. It was me being completely with myself and reconnecting to me, my needs, how I want things to be. that is what it was. I needed to completely strip myself naked, absolutely naked, that I can build myself again. Who am I when I'm a new situation? Not only that I'm divorced, I also was married for quite a lot of time, and we had a little kid together, and um, that was stripped off. So I had to strip even more, become even more bare, that I can really understand what are my priority, what am I liking or disliking. Back then, that was my way of dealing with that. But it would be probably completely different how I would deal it right now, because it's probably quite dramatic way of dealing with traumatic situation. If you can, it helped me. It helped a lot of people to remove. Some of us here in this room also were in traumatic situation in one area of United States, right? And they moved to another state to remove them from the traumatic environment, that nothing is reminding them about the past. Back then, this is what I'm talking, if you're interested in back then. And right now, I would definitely trauma therapies right now, we have such advances in how we deal with traumatic memories, and we have such a different understanding of trauma. My divorce happened when we actually didn't know that much. I was divorced in 2010, and in this 13 years, we have so many things different. We have somatic therapy, we have better understanding of EMDR, we have EIMT that I absolutely love. We have so many different beautiful modalities to go through trauma. Of course, that I would probably, if that is not how you want to deal with situation, that's definitely going through therapy, self-discovery. That is the way. Yeah. I don't know if I answer your
No,
question, Steve. I don't know if you want to know, but okay.
No,
Thanks.
Thank you very much.
Thanks, Steve. There was also, yeah. Somebody was raising.
Rachel?
Rachel. Oh, hi, Rachel.
Hi, thank you. I just want to tell I might be interrupted and have to go abruptly, but I appreciate you calling on me. So I have a question for you, Doctor. In terms of, so let me ask it this way: after you changed careers and became a therapist, were you struggling still with feelings of unworthiness and inadequacy at that time? And the reason I ask that question is because I'm not a psychologist, but I am a social worker and worked clinically. And for me, I find that the biggest struggle I have is the disconnect between what I know and what I feel. So I know what I need to do. I know I can analyze where the feelings of unworthiness and inadequacy are coming from. I know that I have to unlearn everything that was told to me about who I was. I know that emptiness or that nothingness or no thing brings about, existential crisis, panic, ontological insecurity. Yet, and part of me, when I tell other people, no, you are inherently worthy just for being a human, like just being a human being, not a human doing. Any sentient being has worth. But if I tell myself that I'm not worthy or that I feel inadequate, then I am also sending that message to others, because what makes me different than another person? And so I struggle with the analysis and the understanding and trying to figure out how to undo that. I don't know if that makes any sense, but that's where my struggle lies right now.
Okay, so I really like the question. So the one bit of the question, how I want to answer that, it's about feelings and reality. And I tend to be incredibly selective to the feelings that I'm feeling. Feelings are given to us for protection. There's nothing else. Feelings are there to um, post us in a direction of there is a threat. We need to watch out. We need to, or if for it's always some sort of or if it's a positive, to connect to how we can get more, because that's again for survival. So I am very, very selective how I see what I feel and what I think. If that really serve me, the feeling that I feel right now, if then I will definitely pursue that, because I feel like innately what I want is to be a better person every single day. If something puts me down, something sway me for me being like this, as for me, for my family, for my clients, I tend to disregard this kind of voices, because these voices we always will be having these little nuggets of, um, you know, are you good enough for this kind of thing? And this is for us a signpost to um, either strive for better, or just really analyze how is it something that we need to pursue for real. And if that voice really help us to get better, then yes, absolutely, go and listen to that voice. And if that voice making us feel small, you need to really understand, why do we have that voice? What is this voice is telling us? And there is always going to be some sort of negative, you're some sort of doing or being, and all possible other dualities in our mind. And the thing that we can do is to building relationships with these dualities. If I feel unworthy, I want to build a relationship with this voice who are unworthy. I want to ask it when it was born, what is this serves us? Why does it want to make us small? Because this voice really helped us in the past. For example, if we were in an abusive relationship, that feeling of small made us survive by being unseen by our abuser. By if we wanted to hide somewhere in a room, when we wanted to sleep, when we wanted to be just under the blanket, that was their mechanism. But right now it's not serving us. So you need to build a relationship with the voice to tell them that, yeah, I can hear you, but I don't need you right now. The other voices that are there, you just really need to understand and build the connection of all personalities that is in your. It's almost like we are always split into good and bad and worthy and unworthy, and all these personalities serves us for survival. And Rachel left, but I hope I answered that question. And I think we talked a lot about that in my previous room. I just not sure if people who are here and who listening to me twice, I feel like we always need to understand these voices. More we're running away, more we're trying to dismiss, run away, trying to mute, more they will be pronounced in our heads. More we build relationship with them, like even giving them names, even giving them characters, better you recognize that when they're coming on the surface, whether they're telling us what is the reason, how they're making you small. And there are a couple of questions. What if you have a hard time feeling worthy or feeling like you're worthy due to the abuse? Yeah. It's a really long way because abuse happens systematically over the years and directed to strip you of reality. So the abuser will have a very good grip on you, so you're not let go, and the abuser will receive everything they need, right? And so that needs to be some sort of systematic way backwards from and building yourself again. And here we again need to understand what was stripped, what is the story, and write the story, and understand how this story protected you in the past, how this feeling of unworthy protected you from the abuser, because they wanted you to not feel worthy, so you're not living, or you're not going and complain, or you won't have guts to fight back. There was a specific idea behind that. So back then, that was working with this part of, because it's just a part of you that feeling unworthy. I'm sure there is a part that feel worthy in some sort of way. There will be part that quite anxious, that there will be part that are quite angry at unworthy part, and would want to kind of like have a fight. There will be always parts, and I just invite everyone to have this relationship with the parts and talk to them, and again build kind of understanding what they're trying to tell you. I don't know if that answered your question, James. Rachel left. And Chris, how do I remove intrusive thoughts of my wife being intimate with another man? The thoughts hit me multiple times a day and they are physically painful. I'm just wondering if that's your thought, that your wife wants to be intimate with another man, or she explicitly say that she wants to be. Okay. Every this is again another layer. When we're in a relationship breaks in this kind of way when there is some sort of a woman or a man, they crave something that they don't have from their partners that they are with. I wonder what is that she's seeking in that man that she's not getting from you. And sometimes the conversation around intimacy and what is she craving in that man might some sort of give you a direction what you can do for her, so she would remove, or somebody starts to talk.
What?
Yeah. Okay. Intrusive thoughts might be quite difficult to remove, especially if a person has a proclivity to intrusive thoughts. It's almost like OCD, but it's mental OCD, and it's really hard to remove that easily. So if you talk about intrusive thoughts, in my mind, it's straight away, it's obsessive compulsive disorder, but not in a physical way, how like washing hands, but in a mental way. And it's really hard to then remove that if that intrusive thoughts, like I think, then it can be removed with treatment. Also, they need to be a conversation. She already come to you quite honestly, and I quite like that you have still relationship and understanding what she craves from that relationship that she's not getting from you, because that's always the reason between the couples. This is why they are looking somewhere else to get it. Do you think I answer your question, Chris? Do you want to tell me a bit more? But yeah, if for her intrusive thoughts make you thinking about intrusively, I can see it might be physically quite painful. Yes, Grace. Legally separated, wants to go to counsel anyway, still married. She left because she wanted. Sex was the issue, but the other thing. Well, that yeah, I understand it can be painful, but unfortunately, okay, so you can't stop thinking. So you said she had intrusive thoughts about having sex with another man, but it feels like she separated from you because she thought that there wasn't not enough sex. So that could have been solved if there was a conversation. She should have had a conversation with you, Chris, about what are the needs, and there should have been a conversation about that. So she was of course craving that intimacy from somewhere else, because unfortunately she felt that she didn't get it that from you. So yeah, so it probably thoughts are there because you don't have objective reality of what is going on. This is why your brain kind of builds those movies in your mind to kind of fill the gap of what you don't know, because that's what brain does. When we don't know something, we immediately build pictures in our minds just to make it easy for us. Usually these pictures are quite negative. We never picture anything positive is happening. So usually what you create in your mind is much, much worse than it actually usually is. And it's always about the attention, right? Our attention can only hold three things simultaneously. So when you, for example, sit and, for example, you're working, right? And these thoughts just running through your mind, and you completely lose an ability to even concentrate on your work. And this is what your attention is going to, right? We need to train our attention to concentrate on three different things. For example, you need to connect to your body and see what's in the point of connection to maybe a chair or a sofa. Then if you have some sort of like sensory things like sensory bowls or something to touch and something to maybe smell or watch something, it's always about attention, where your attention goes. Your attention right now goes to building that pictures that are probably far from reality, because if she wants to reconnect to you, she feels like there probably a chance to this relationship. She just wants to have more intimacy with you, and yeah, that's why her craving sex may be quite physical, that she needs to satisfy herself, that she's not receiving from you. So if you work how you can work on these kind of issues, then absolutely the conversation needs to be, because it feels like conversation is not there, because you didn't know that she needed that intimacy. And and she left. But for you, it feels like your attention is right now there, and how easy it is to go there, because it's such a protective, again, reaction, right? You build in all these negative images in your mind, but swaying your attention back it needs to be a kind of conscious way of doing that. And as I said, like 3 things that you need to connect: maybe smell, sight, and maybe sensual, where your body placed. It's only putting your attention, reverting your attention away from the painful situation, that is only way how you can deal with intrusive thoughts. There is no magical tablet to that. I don't know, Chris, if... Okay, Chris left. Jay.
Hi. Thank you so much for coming on here and being vulnerable and kind of sharing the story. And it definitely, like, I can relate to some parts of it. Like, I've always known that I had like a purpose in this life. I've always wanted to be a therapist, but my parents wanted me to be a nurse. So I went to nursing school, failed out once, failed out twice, 3 years later. And then the year after that, I wanted to use my college, so I went back to school and became, and got my medical coding degree. But like right now, like I still have to go and get my certification. But one thing that I've always had, and I always have, like throughout my life, it's like a consistent like repeat of like working jobs that I really don't enjoy. Because like I worked for Amazon for 9.5 years. Absolutely hated it, but I just did it because I was going through school. And then I bartended for 7 years, and I absolutely hated it, but I was just doing it to get extra money. And then like right now, I am working a job, but I am working a job that has the opportunity to put me where I want to be. But I've been doing the coding for the last 8 months, but I don't have the actual position as a coder. I have a position as a billing specialist, and they're not paying me as a coder, but they're taking advantage of it. So it's okay with me because I'm getting experience.
Mm-hmm.
But it really leaves me feeling unfulfilled, unworthy, because I have this background, but I know I'm not certified yet, so I can't really put my foot down until I get my certification. But I totally have like this like repeating effect in my life that I am failing, and I keep I keep trying. I know that there's purpose, but I just like keep repeating, like hating, like what I do, and I'm tired of being like unhappy. So like,
It feels like you're telling me a story that you wanted to be a therapist. Like, therapist, you mean like a doctor, or a psychotherapist, you mean?
yeah, like a psychotherapist.
Yeah.
I've always wanted to, but I don't
But
want to go back to school.
you never pursue that. You yet got another profession that is nothing to do with psychotherapy. So I wonder how are you getting into professions that are nothing to do with psychotherapy?
Because at the time that I chose to go back to school, I had to use my credits that I've gotten to get a degree. I had like very short amount of time to where I had to actually jump into a program, and so that just was the program that really did. And I enjoy it, as in like I have like trying to think. Oh my gosh. I don't like talking to people. I'm very like socially awkward. And so it's I like working like behind the scenes as a coder. I do like it, but I just
You feel like this profession would fulfill you? You think that that is what you'd happy doing as a profession?
I feel like it. I don't know. I originally had a reason why I was bringing all that up, but I forgot it while I was listening in.
You were saying that you always wanted to do something, but you never had a chance to do, and you feel unfulfilled. And this is where I thought that our conversation is going. But then you said that actually coder is maybe something actually quite fascinating, isn't it? To be being a coder, it's kind of you put in numbers there, and the program execute wherever you're coding into that. I feel like it's fascinating. But anyway, it feels like this is something that might bring you a fulfillment.
I know. Okay. I know what I wanted to talk about. I'm so sorry. Okay. But it was totally so I know that like I have like a back reaction of me wanting to be a therapist, but I try to rush into so many things, but I'm also 30 years old. So like I'm trying to rush in, and I want to like have a family and all of this stuff. So I like last year I went through like some intense what do you call it? Intense fertility treatments and stuff. But I realized that it was just not the right timing, and I just need to relax and stop trying to conquer a billion things all at once. And so I'm trying to embrace being happy with where I'm at. So like that's where I'm trying to find the worthiness of being able to be just like okay with where I'm at.
But you're not, because it feels like there is something else out there for you that you can't put your finger on what it is. Because there's always something missing in what you do.
Well, I always thought that I would be a mom, but it just hasn't worked out just yet, and I miscarried last year, so then it just defeated me. But
I had when I was pregnant with when I had my first child, I couldn't get pregnant for 5 years. I had all possible treatments, and this I can hear a lot of how I was thinking. That I want to be a mom, I want to have family, I want to have minimum 3 kids, and I just was picturing myself this happy family dinner together, but it never was happening because I kind of like put I don't know if that is thing for you, but I can hear something that I was also telling myself back then. And this picture was kind of put me in a stress every single time I had periods. It was an absolute heartbreak for me, because that's yet another failure. And 5 years I couldn't conceive. When I decided that's it, doctors told me that I can only think about surrogacy. I will never ever get pregnant. And this is why I decided to kind of stop having these pictures and concentrate on me and my husband. And we started to travel a lot. We started to live just for us, concentrate on our jobs, completely forgot, completely put aside the idea. And I know I spoke with Chris about, attention can be a very tricky thing. It's only that thing that, it's almost kind of like a only idea. I want to be a mom, but I managed to put it aside and concentrate only on myself, on me and my husband. And what do you think? I got pregnant without any medication, like without anything. Like it went completely crazy on holiday when we wasn't prepared to get pregnant, when we already put that idea that we're going to be just us and that's it. And I actually work with a lot with infertility therapists, and it is always sort of tension when you're trying to conceive, because that is, I need to do my biological ticket, clock is ticking, this only now because it's the best time, and all this pressure actually make the chance of conceiving very, very little. And I just proved it on myself and in so many women who are trying to conceive. Either I work with those who lost their kids as well, but who were born and they lost and they're trying to conceive again. And more you put pressure on yourself, on your system, because when you stress, all system shuts down, but only those who needs for running away from stress, because stress innately evolutionary, it's something to keep us safe from the predator. And this is their idea. Immune system shut down, reproductive system shut down, only cardiovascular system is kind of on overdrive. So every time you stress, you tense, that sends a signal. I need to shut down everything that is not necessary. And reproduction is not very necessary when you have to run away from the predator, which is really what you're doing. I don't know if that question was about fertility, but I felt like I can hear so much of what you're saying in my stories. When I was conceiving my first child, my second one was just immediate. We decided to get pregnant, and I got pregnant, and all these really horrible stories from the doctors that said that I will never ever be able to conceive. It kind of felt way so. But really, if it's a question not about fertility, but about the connection to yourself and connection to understand what you really truly want, I think it's a beautiful time for you to slow down. And even in specifically on slowing down and not rushing, this is where I would say like miracles happen. But really, because you're noticing so many things, you can connect to yourself, to your body, to your relationship so much more, and discover really truly what you really want. If it's a coding, yes, but you're still 30. I changed my profession 3 times, fighting myself, and the last one was when I was 37. And there are so many beautiful examples of how people completely change in their career. I have one patient who was accounting all his life, and after retirement in 65, he decided to pursue his long term passion for archaeology, and he completed a degree in archaeology at 65. And I saw him when he was 68. He was completing his degree, and he was going to for his first field trip somewhere, and he was incredibly excited. And it's almost like he started to live new life. You have the whole life of discovering what you truly connect to, and it might be completely different in your 20s, 30s, 40s. I bet you will change your mind from coding to something else, and you have still so much time to discover what you truly really want. I don't know if it was useful, Jay.
Thank you for that.
Yeah. Okay, there's 3 minutes left, and thank you so much for all coming and listening to me. I'm not sure how much usefulness in this room that was, as I said at the beginning, I feel a bit burnout at the moment, and I'm still recovering very slowly, being quite gentle, but decided to show up because that's the most important thing, connection and showing up to people and to yourself. Hopefully somehow it was still useful to be here in my space. So I'm really grateful and really thankful for you all to come here to my room. Okay. Thank you. Thank you so much. Thanks, Lily. Thanks.
Thank you so much for sharing that, because I know from my personal experience, I have a lot of anxiety too over where you're supposed to be in life, and everything has to be so linear, and it hasn't been at all.
No, it's never gonna.
And
Yeah.
exactly, and then when it's not, or it's I don't even, I know I know now to be self-compassionate, but I still have that voice, like you almost failed, you're a failure. That's really harsh, but it is
It
the
is.
truth.
Yeah, I have this voice as well. Don't think that therapists or people who maybe achieve something, they don't have that. We absolutely all do. But the thing is, if you're listening to that or not, anxiety is always coming from something that you trying to predict, but you can't predict. And really, how much really can we predict of the future? How much we can plan and account for all possible adversities that is happening to us? I thought that my life is completely planned out, and it's completely broke, and there's so many pieces, so many times. So you absolutely can't plan for anything. It's just resilience is. I'm doing a lot of studies right now on resilience, and um, it just shows that self compassion is the one thing that can build your resilience. Be very gentle, be very understanding that right now, yes, you're going through maybe stuff that you dislike, but there will be a time when this time is over. My time right now, I feel incredible discomfort. I feel that today's room was not the best room that I was leading, and I compassionate to myself, because this is the best I could do for today, because I feel really run down, and my mind is not really in the right space, because I was carrying so many stories from so many clients over this year, and I never took a break, and that was a big mistake, and now I'm paying for that, and I'm compassionate to that right now I feel really not the best of myself, and I want to beat myself up. I want to say like, oh, you're such a failure, and what a rubbish room that was. But I will choose not to. I will choose to listen to my compassionate voice. Yeah. Jay.
Okay, I'm not sure how much help this would be, but I just want to say thank you so much for sharing and allowing me to kind of relate into like the struggle. The struggle with fertility is horrible, and I know that it's like not a topic that a lot of people like to talk about. It really truly sucks.
Yeah.
And then having a life that you thought you would have had, but being able to like let that go is a struggle, but I'm working on that. Because it's sad to see like others, they get married, they have their kids, they have a
Yeah.
happy life, and blah 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 blah. It just seems so easy for them, and
Yeah.
then like you're sitting here and they're like, just relax, just stop thinking about it. It's not that easy, and it's like,
I
but
know.
I understand. I need to sit back and enjoy, because I have built a really beautiful life, and I'm going to let it just fall apart if I don't enjoy it. So I get that I need to embrace that.
Oh, absolutely, Jay. I can
I,
hear you. Absolutely. And
I
so many people
really
just,
appreciate
yeah,
it.
so many people told me to relax and forget. And I was like, that's just bullshit. I can't relax. I want to be a mom. I always want to be a mom. But when I heard that I will never get pregnant, like that's impossible for me. It's unattainable thing, because of the physiology of my uterus or something like this. I won't get into details. And I said like, well, okay then. I've done everything I could. I was on hormonal therapy. I was on, oh my God, so many different things for 5 years. That was in my mind, and then that kind of diagnosis kind of made me not everything else. Not that I decided, oh, I need to relax. No, the diagnosis. I didn't want to go surrogate level. I didn't think of like somebody else carrying my baby. Absolutely couldn't back then. But that thoughts make me kind of let it go. that thought, like, I will never get pregnant. Just like, let's just stop thinking about that. So I brace myself and put myself in a lot of work, into a lot of travel, into a lot of connection with people. I just completely forget. And around me, my best friend, she had fourth kid when I received news that I will never. So I know, Jay, I can absolutely hear you, understand what you're going through. But really, they actually, they suggestion really works. It worked in my case, that when I let go, when I relaxed, when I completely forgot that my motherhood is not for me, I got pregnant without any medications, without doing absolutely like nothing. I get pregnant. So I don't know if my story will kind of put you a little bit in a frame of mind that everything is possible. Absolutely everything is possible. And I work with so many ladies who couldn't get pregnant, and there are so many beautiful therapy modalities that you can go to and switch kind of that idea into something completely different, put that in your subconscious mind. And I believe, we all can, we all must, those women who want to be pregnant, it means that they have all the chances why we were put in this life, to get to be moms, if we really truly believe that inside of us we are. Okay. All right. With this, Jay, I hear you, I feel you, and I completely with you. Hope to see you guys all next week. I hope I will feel much better, and it will be much much different space in here. So thank you for coming. I love you all so much for your support. Thank you, Lily J. Thank you, Katrina.